Ladies and gentlemen, welcome to the Prescription Misuse and Abuse Among Adults webinar. Your host for today, Bob Link. You may now begin.
Thank you. Hello, everyone. This is Barb Link with MPRO, and this is Michigan's Quality Improvement Organization that is a part of the Lake Superior Quality Innovation Network, or Lake Superior QUIN. Lake Superior QUIN represents Minnesota, Michigan, Wisconsin, under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. While the focus on the prescription drug abuse epidemic is on younger adults, addressing the needs of older adults is also a key component of community response to the opioid epidemic. This presentation will provide an overview of the impact of the opioid epidemic on older adults, information about identifying signs and symptoms of prescription misuse among older adults, and strategies for prevention. Today's educational session is entitled Prescription Misuse and Abuse Among Older Adults, Understanding How Older Adults Are Impacted by the Opioid Epidemic. Before I introduce our speaker, I'll mention that all lines are muted during the webinar. However, after the presentation, we will have time for questions and answers, so please make a note of any questions that may come up as you are listening. Or you may use the chat feature, which is on the right side of your screen, and we will address your question at the end of the presentation. Now I'd like to introduce our speaker, Katie Wendell. Katie has worked in the Aging Network for almost 4 years and is an advocacy specialist at the Area Agency on Aging 1D in Michigan, which provides services to seniors in 6 southeastern Michigan counties. In this role, Katie monitors legislation, coordinates grassroots advocacy efforts, and works with elected officials regarding issues of concern to older adults. Katie's interest in the substance abuse began during her internship at New York City Department of Health, Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. Katie has a master's degree in social work from Columbia University. And Katie, now I will turn it over to you.
Katie, your phone might be on mute.
Katie, your line is open.
Katie, I'm not sure if you're speaking right now, but we aren't able to hear you.
Yes, Ms. Wendell, she's connected to the call. We tried to pull her line out individually, but we're not getting a response. Ms. Wendell, maybe, I don't know if your phone is muted on the handset.
Hi, can you hear me now?
Yes.
Oh, I'm so sorry about that.
That's okay.
Where did you lose me? We didn't hear anything.
I am so sorry. I thought I was going. I will start again. My apologies to everybody there. Not sure how that happened.
I'll hear you now.
Okay, so sorry. So I will start back over again. So thank you, Barb, for the introduction, and my apologies again for the technical difficulties there. So as Barb said, I'm a social worker working at an area agency on aging in Southeast Michigan. So my interest in this topic really comes from more of a public health prevention standpoint. Not a doctor or a pharmacist. There are definitely huge portions of this conversation that need those medical influences. So I just wanted to give that caveat before I really dive into the topic. And we really got started on our work here at the Area Agency on Aging 1B in summer of 2016 with our advisory council made up of community members and older adults where they select a topic to dive deep into to create a report. In 2016, they chose the issue of prescription misuse among older adults. So that's a little bit about how I got started working in this in my current position. We all hear a lot about the opioid crisis, the opioid epidemic. There's a lot of news coverage. Public awareness is really increasing right now and has for the last couple of years. And there's also been a lot of movement in public policy, government investment in both prevention and treatment of opioid use. But we don't really talk about older adults a great deal. But those of us who work with older adults and people with disabilities know that they're part of this conversation. They're connected because older adults are consuming opioids. They're impacted by abuse and misuse personally, and they are, working with their family members who are experiencing it. We've personally seen a rise in the number of grandparents raising their grandchildren after their adult children were seriously impacted by personal experience of prescription misuse, possibly leading to heroin use. Older adults are access points also for those seeking prescription medications. But as you see on this slide, it's difficult to identify data regarding the prevalence of this issue among older adults. Estimates range widely. It's hard to get good data. And part of that's because they aren't the focus of study for prescription misuse. They are less likely to fit our stereotypes for addiction. They're likely to have complex medical conditions and be experiencing chronic pain. Their prescriptions are most often obtained legally due to a legitimate medical concern, which is different than some other portions of the opioid crisis when we're talking about it nationally. Even when we are aware that someone has been using opioids, the condition isn't reported. It's less likely to be specifically deemed a cause of death for older adults. Often deaths related to opioid use would just be coded as a medication interaction and considered, unfortunately, fairly normal for an older adult. So even when we have some suspicion, the data is not really reported in a way that, for public health purposes, we can report back on. To make sure we're all using the same language here during our conversation today, I think it's helpful to define the terms. So addiction, we're defining as a chronic, relapsing brain disease characterized by compulsive drug seeking and use despite harmful consequences. Physical dependence occurs when a body adapts to a drug, requiring more of it to achieve a certain effect, to be on a tolerance, and also experiencing withdrawal if a medication is ceased. Misuse, which is what we'll talk about a lot with older adults, is both intentional or unintentional use of a medication without a prescription in a way other than prescribed or for the experience or feeling that it causes. So older adults' path to addiction, as I mentioned a little bit earlier, looks a little different from others. They're more likely to have been prescribed opioids for long-term pain management. So the path to addiction, rather than becoming quickly hooked, as we talk about with younger people, they might have been following doctor's instructions to use a medication for a long time, and then are experiencing the physical symptoms and needing more and more of the drug to maintain the feeling that they achieve from taking it. They're likely to obtain medications legally through one physician, and when things get a little bit more serious with older adults and they're experiencing more addiction-type behaviors, possibly doctor shopping, moving from one physician to another, and able to obtain medications legally. And it's less likely to be associated with social or peer pressure. So what are opiates or opioids or narcotic medications? It's really important that we talk to older adults that we work with about this, because when doctors prescribe you an opiate medication, they don't tell you it's an opiate. They don't point at it and say, these are the ones that everyone's talking about. Many older adults who are taking opiate medications, maybe have even been taking them for years, don't realize that they are taking these addictive, scary drugs that they see on the news at night. So opiates are prescription drugs used for treating pain. These drugs can be abused and can lead to addiction. Their effectiveness, most current medical information, they're very effective for short-term use, usually safe and effective. Long-term usage can increase your tolerance and lead to physical dependence. The most medical recommendations are for short-term use. With a definite exception for cancer, pain, or possibly hospice applications. I'm not really talking about those scenarios here. So common opiates are codeine, Vicodin, Norco, also known as hydrocodone, morphine, OxyContin, Percocet, oxycodone, fentanyl. Those fentanyl patches for older adults are especially significant because they're very high dosage of opiate medications. So older adults are more likely to be prescribed these medications from a physician, and the attitude towards taking the drugs is saying, I'm doing what my doctor told me to do. A place where professionals working with older adults can have some impact is to help older adults identify what prescriptions they're taking fall into the category of opiate, and ask or suggest some questions that they can ask to their doctor when they're being prescribed these medications, or when they first realize, I'm taking something that has potential to be addictive. And some questions could be, how long should I expect to be on this medication? Like I said, most information indicates they're best for short-term use. So if you're receiving a prescription for an opiate, it's nice to know when the end should be, and what your doctor expects that to look like. Asking for clarification from the physician as to what they mean by taking medication as needed. How much pain should you be expecting a couple of days after the procedure? Should I only take my opiate pain medication when pain becomes, so unbearable that I can't sleep at night? When should I switch to an over-the-counter medication, perhaps? And also ask for any other alternatives or things that can be used in conjunction with opioids to manage pain. So signs and symptoms of opioid misuse can include any combination of these or just a few. So unexplained fatigue, confusion, balance problems, forgetfulness, depression, agitation, sleep problems. And look at this list, you can see where we might have some issues working with the older adult population, because these symptoms can be clearly confused with other diseases or issues associated with aging, possibly early onset dementia, something like that. So when we're seeing these symptoms, balance problems, frequent falls, we might be looking for a number of other disease-oriented options or, increased frailty due to age, and may not be considering the impact that medications could be having on the older adult. So it's important to consider those medication effects when we see some of these symptoms. Another group of drugs that are important to mention when we're working with older adults are benzodiazepines. This group of prescription drugs is used for panic attacks, anxiety, insomnia, muscle relaxation. And they're also fairly addictive and can cause greater harm when paired with opioids. So these include Xanax, Klonopin, Valium, Ativan, often used by the older adult population, and there also seems to be an assumption that they're safer to be shared. We hear often about, here, take one of my Xanax, and these drugs have addictive properties, and we should be asking some of those same questions of physicians when they're prescribing them as we do with the opioids. So it's another group of drugs that it's important to name and make sure older adults know the risk. So some of our key messages for the older adult population when it comes to increasing our safety around opioid or benzodiazepine use, these 4 key takeaways I borrowed from Operation RX of Macomb County. So it's Macomb County, Michigan's collaboration to try to address the issue of prescription misuse leading to heroin use in the county. So the 4 taglines: never share, take as prescribed, store securely, dispose safely. So never share. Older adults and all of us like to be helpful and assume the best in others. And so when a friend says, I'm feeling some pain, I just fell and had X, Y, or Z happen, I haven't been able to get to my doctor yet, could you loan me some of your medication? Especially in senior living buildings where there's a lot of older adults living in close proximity with one another, this behavior becomes quite common. Drugs are expensive oftentimes and quite valuable, so sharing rather than having your friend need to go out and get their own prescription, see their doctor, pay a copay, go to the pharmacy, sharing can seem like a reasonable idea. The education piece as to why you shouldn't do that. We don't know possible drug interactions. Your friend might be taking a number of other medications, and when you combine with this, it could be quite dangerous. Dosing can be different. So even if you're taking a medication that you've taken before, you feel pretty comfortable taking, you may not realize that, the dosing's different. It's a much more potent opioid medication, which can really affect your body more than you are imagining when you're taking a new medication. It's not always easy to identify patterns of misuse in our friends and family as well. So while your friend may only ask you every now and then, they could be asking multiple people and obtaining larger amounts of prescription medications than you realize. So it's a best practice for those you love not to share your medication and not to ask other people to share medications with you. Taking as prescribed, we talked about those key questions to ask your doctor earlier. So how long can I expect to be taking this medication? What other alternatives do I have? Does this medication carry a risk of addiction? So that's an important part of taking as prescribed, to ask those questions. Oftentimes in a doctor's visit, the handing over of the prescription happens right at the very end where you're getting rushed out the door. And empowering older adults to take the time to ask those questions is important. Another aspect of taking as prescribed is to not save your medication and take them later for another condition or for a much later reoccurrence other than what your doctor prescribed the medication for. It's best to go back to your doctor again or at least call and talk to them about the medication you're taking before you consume it again. Securing medications. This is really important because it prevents accidental misuse and accidental ingestion. So what I mean by that, accidental misuse for yourself personally could be, I didn't remember that I had taken my medication earlier today. It's sitting out on the counter and I took it again. Certainly something that happens with the older adult population. Accidental ingestion, whether by children or pets, also can happen if medications are left unsecured. Securing medication also obviously helps prevent against theft. Medications are hard to replace, so if your medications are stolen by someone that enters your home, going back to your physician, getting a doctor's order to replace the medication isn't a given. It can be really difficult to do. So if you have a lot of people coming in and out of your house, if you have grandchildren coming in and out of your house, securing that medication is a good way to protect them and you. I know many of the older adults we work with have shoe boxes full of medication under their bed or bathroom cabinets that are filled with different types of pills from different times in their life. There are some recommendations for getting those locked up. So if that's a lockbox with a key, that's a good option. Maybe put that in a bedroom. We recommend not storing medications in a bathroom because a bathroom is a place in a home where guests can expect to go and be alone. So commonly, prescription pills can go missing out of bathrooms because there's no way of monitoring what someone's doing when they're in a bathroom alone. So we recommend taking those medications out of the bathroom into more space in your house where guests wouldn't be alone, and to lock up, especially prescription medications. One of the important things about naming those opioids and benzodiazepines is that we can help older adults prioritize what medications should be locked up. If someone's taking many medications, it may not be practical to put them all in a little lockbox, but some of these, most important, most sought-after medications should be put behind a lock. Another option that our agency has used a little bit is a locking pill bottle cap. So rather than having to, put the whole pill bottle in a lockbox, you can purchase, we used one called the Safer Lock. You can buy it on Amazon. And it's a large pill cap that you can twist on a standard prescription pill bottle, and it has a customizable 4-digit combination. So if someone doesn't commonly take a lot of medication, maybe using opioids for the first time after a major surgery or acute injury, you can purchase one of those and just lock up that one bottle of pills. Kind of an interesting solution there. And then medication disposal. This is really where my area agency on aging has done the most work. Older adults, we are finding in our communities, were keeping all of their medications, really despite how old they were, or potentially dangerous. And medication shouldn't be flushed down the toilet or thrown away if possible, due to the environmental concerns with that. I always say to older adults, though, if you are concerned that someone entering your home might be prone to stealing your medication, doing those things in a bind is absolutely worth, preventing someone misusing drugs. But the best way to dispose of your medications is to use an approved drug take-back program. So in Michigan, every state police station has one of these large drug disposal bins, kind of like the cartoon version pictured on the slide. And these bins are permanent, bolted to the ground, and it's a one-way entry, so you put your pills in, and those bins are actually the contents are picked up by the Federal Drug Enforcement Administration, and those pills are actually incinerated. So it's the best way to dispose of them without having an environmental impact, which is especially important for our water system. Many local police stations also have these in our area. I think it's common in other states as well. And a newer innovation in about the last year and a half is that some Walgreens locations are adding prescription drug take-back systems right next to their pharmacy. So in our region, we only have a handful at this point, and I think that might vary state by state based on regulation. But it's an exciting new thing because it makes sense to carry your old medication back to the pharmacy with you and dispose of it there. So look out for those local programs. There's also DEA, so the Drug Enforcement Administration's drug take-back days. These occur, I think, quarterly every year, and community take-back locations all open up on the same day to encourage the public to dispose of their medications. So the next drug take-back day is actually this Sunday, April 28th. So the website for that is takebackday.dea.gov. And when I looked it up just a little bit ago, I had 4 community take-back locations within 5 miles of my house. Of course, I live in a suburban area, but they are very common, so that's a great resource as well. We understand that for the older adult population, getting to a drug disposal location can certainly be a barrier. If you're homebound, can no longer drive independently, getting out to do something like this can be really burdensome. And in many areas, having someone else transport your prescription medications gets into some legal issues. You don't want to, send someone with, a whole bag of prescription medications that aren't theirs in a car. So how can you dispose of drugs safely at home? If you can't flush them and you're not really supposed to throw them away, there's a new technology called the doTERRA drug disposal pouches. These come in several different sizes, a little bit like a Ziploc bag. You rip off the top piece of plastic, open it up, and inside there's a charcoal pouch, and you can dump prescription medications in this pouch, add water, zip it up, shake it up a little bit, and that charcoal will actually deactivate prescription medications, making it safe to throw away in the trash. So using a grant, my agency purchased about 700 of these pouches and worked with local home-delivered meal providers to get these pouches into the hands of home-delivered meal participants who are homebound in several of our counties. So that's certainly an option. They're a little bit expensive for wide-scale use, I will admit that. And we did a study after we handed those pouches out. We only gave them to folks who were interested in using them and said that they had some drugs to dispose of. And even then, a little under 50% of those who received the pouches reported that they actually had used them to dispose of medication when we followed up about 2 months later. So, that urge to keep medication that you paid for and you might need again someday is still really strong, so we're working on the education there. But I did want to present that as an option. So once again, that's the doTERRA drug disposal pouch. So some additional steps that professionals can take to combat prescription misuse. I encourage all of you to add to any assessments that you do with older adults to ask if they are concerned about any of the medications that they're taking or if they have any history of substance use. Often we don't consider this as an issue with the older adult population, but we need to remember that many older adults have a previous history of alcohol or drug abuse, and when their doctors are recommending potentially addictive medications, it can cause a lot of anxiety. And there's opportunities to increase the dialogue between physicians and older adults when addictive medications are being discussed. So providing some support in that area is great. Provide education on medications that pose a risk, and make a plan regarding long-term opioid use. Locally, we held an event for family caregivers, and we had a physician come to talk about opioids with these family caregivers. And the most common question the physician received from family members was, is it normal for my loved ones who've been taking this medication for so long? That people were reporting, my mother has been taking, opioid medications for years. So if someone's been using opioids for a long time and is interested, with their their doctor's advice in stopping that or limiting that opioid use. Making a plan is incredibly important. Opioids are strong drugs that bodies develop a dependence to. And as I talked about earlier, you can experience very serious withdrawal that can be especially dangerous for older adults with other medication complications. So making a plan if you want to cut back on that dosing over time. Include information about proper medication storage and disposal in home safety assessments. So if you do home care, when you're going into a home and, assessing it for safety, if you see, all the prescription medications out on the kitchen counter, or perhaps all in, on the bathroom sink, include some recommendations about the safest way to store those medications in the home. Also, create a referral list of options for community drug disposal. So maybe talk to some of your local police stations in the area you serve. Learn about options for disposing of those medications on site, and also ask about options for caregivers who want to help dispose of medication. Is it okay for me to drive my mother's medications to your police station and dispose of them? I found local police departments can be very helpful with those concerns. When evaluating health changes, ask how medications could be involved. An important reminder for all of us. And then prepare to refer older adults to substance use treatment. It's not a referral that we make very often in our home care programs, but we need to make sure we have the resources to be ready. Also consider referrals for naloxone if individuals have concerns about overdoses. For those who aren't familiar, naloxone or Narcan is the opioid reversal drug that you can get it in a syringe form to give as a shot, or a nasal spray, which is especially popular in public health applications. So this is the drug that police officers and fire departments carry and administer right when they find someone who is experiencing an overdose before they get transported to the hospital. So if someone is experiencing addiction and family members are concerned about the risk of an overdose, this drug is becoming easier to get through local health departments. You can also ask your physician to write a prescription for that overdose reversal drug. Another program we have is part of the evidence-based programs for older adults titled Personal Action Towards Health. So there's a diabetes personal action towards health path, or diabetes path. There's a general chronic condition path, and we have recently become trained in our region to offer chronic pain path. So this is a 6-week course for older adults who are experiencing chronic pain, looking for tools how to manage it. So it's certainly not addiction treatment, but chronic pain and opioid use are obviously linked, and it helps people explore alternatives to managing pain. In our 6-county region, we have community-based coalitions operating in every one of our counties here in Michigan, and I think this is very common across the country right now. So this is just 3 of our 6, and I think it's very important for these multidisciplinary teams to have someone who works in the aging sector at the table when they're working on prescription misuse. You can learn a lot about your local community drug take-back events, current trends. Most of our coalitions have police officers involved, so you can hear about new drugs that they're seeing more commonly in the community, with like carfentanil and some of the newer opioids that are coming up. They also commonly distribute the naloxone for opioid overdose that might be of interest to family members. These coalitions are also often involved in public policy related to prescription misuse. Most states have a prescription tracking system. Here in Michigan, it's called the Michigan Automated Prescription System, or MAP. What these systems do is they track when a doctor prescribes and when a pharmacy dispenses medication. So we're talking about a digital IT system where doctors and pharmacies can log in and see if someone has gotten medications from multiple sources. Maybe if they received too many pills in a short amount of time that their doctors might not know about all of these medications that they're taking. There's been a lot of policies around these systems nationally to try to avoid overprescription, to identify doctors that might be giving out too many prescriptions than is reasonable, and making opioids a bit harder to get. And this is difficult for older adults because many of them are taking opioids for these chronic conditions as prescribed by their doctors, and some of these hoops that they're being asked to jump through to continue to take their medications are very frustrating. Things like having to go to the pharmacy in person to pick up your medication, having to see your doctor for every refill, or at least every 6 months, or some of those new regulations can be really difficult. So providing education about why some of these things are happening, what they are in response to, can help older adults understand them a little bit better and hopefully navigate that space. So, but we're seeing those keep cropping up here, and I think other states are as well. So something to be on the lookout for. All right, with that, I think I'll open it up for questions.
All right, thank you so much, Katie. We do now have time for some questions. If the operator will please remind our participants how to get to the queue for questions or comments.
Ladies and gentlemen, if you have a question at this time, please press the number 1 key on your telephone keypad. If you have a question at this time, please press the number 1 key on your telephone keypad. We are waiting for callers to join the queue.
So as we're waiting, is there a question? Okay.
Our first question comes from Molly from Priority Health. Please go ahead.
Hi, thank you. Hi, thank you. Just a quick question on the naloxone kits, particularly in reference to the slide that, many kids are accessing opiates at a grandparent's home. Are naloxone kits safe for minors or small children, or are they geared just towards adults? I've often wondered that, if they can be used in pediatric situations.
Thanks for your question, Molly. My understanding is that it's mostly geared towards adult applications. I have not heard of an instance where it's really been used for children other than a paramedic, administering the drug. I don't know that community, health applications are geared towards using it with children. It's a great question, though, but I've only ever heard of paramedics using for any children. So it's not a definite answer. Probably worth talking to a physician or pharmacist about, but in my experience, that hasn't been the recommendation.
Okay, thank you. Yeah, and they just call like Walgreens or something and ask one of the pharmacists.
Yeah, that would be my recommendation. I just haven't heard of it used that way, but
thank you.
Ladies and gentlemen, if you have a question at this time, please press the number 1 key. We are still waiting for callers to join the queue.
Okay, as we wait, I'll read, there was a question in the chat. Tramadol is used frequently in elderly adults. What are your thoughts on this medication? According to best practice guidelines, opioids should not be used for headaches, typical back or neck pain, fibromyalgia. This is where we often see this drug being used chronically.
Absolutely. Okay, so tramadol, my knowledge of it is that it still has a very high risk for addiction and misuse. That I think initially it was being prescribed thinking it was a little bit less addictive than opiates. I'm thinking of the right drug here. But I don't know that that's held up to be true. And still carries many of the same risks. So, reading the question again here on the queue. And using it chronically long term, I don't believe that that's recommended. Of course, not a physician, with that caveat. But it's very common to see drugs like this used chronically with older adults. Physicians aren't always as tough on, that there has to be an end date for these stronger addictive medications. So my understanding of tramadol is I agree that it's probably used more frequently in older adults, but it still has that addiction risk. That answers the question.
And we'll just check, operator, are there any other questions in the queue?
No questions have come in at this time.
All right. Okay. All right. Well, with that, I would like to thank Katie today for her great presentation. I do appreciate the focus on older adults, but that's sort of my passion and background, and I really appreciated some of the information regarding grandchildren that live with older adults. I know that was very enlightening to me to sort of get that perspective, as well as older adults experiencing some of the similar symptoms from other chronic issues that they might have, and not just assuming that it's from some of the other things that are age-related illnesses, but they also have issues with addiction and use and misuse as well. So we really appreciate your information today, Katie. We're glad that you could join us. So this concludes the educational session, and we do want to thank you again for speaking with us today. Before you close out today, please complete the survey that will pop up, and we appreciate your feedback on today's session. So at WebEx, can you please open up the poll now so people can participate as they close out. So when you close out of the session, then the poll will pop up, and then you can answer the questions. So this session was recorded and will be available on the Lake Superior CLIN website in about 2 weeks. And thank you all for participating, and have a wonderful afternoon.